Hi, I'm Michelle. I'm back to talk to you about my brachioplasty arm surgery. 14 weeks today. I was at the hospital getting ready to have it done. It's been fantastic. I can't imagine and can't even begin to tell you how much it's changed. A lot of people have said to me, have you lost weight? I'm like, no, I haven't lost weight, but my arms have got skinnier. We're sort of looking now at scarring, scar treatments, all of that sort of stuff. So just touching base with the girls in the dermal team to make sure that they're happy with how everything's going. I'm thrilled. If this was, how it got, that's fantastic. I think it's made an amazing difference. So just want to cover with you some of the questions that people might ask or have asked so that you can really understand exactly what we've done as I've gone along. A lot of people ask about sleeping, how could you sleep? So I didn't really struggle with sleeping. I thought that I might. I have had breast surgery previously and found that having to sleep on your back, it just makes everything a bit stiff and stiffen up, and apparently I snore when I sleep on my back. But this was fine. I just ran one arm down the side of my body, the other arm sticking out at sort of a 45-degree angle, and really didn't find it was painful or sore. And then now I sort of sleep like this, and once I've gotten back into complete movement, it hasn't really been a problem. So I think as long as that first couple of nights, 1 or 2 nights, I did sleep in a separate bed to my husband. He sort of flops around, but then once I was back in my own bed, I was fine. Got my own pillow. I think that's really important, that you've got the bits and pieces that make you comfortable. So no back pain or no other stiffness. That was all good. So I think if you just make sure that you've got all the pillows you need, all the ice pack that you want, all of that, I think that you will really find that's okay. A lot of people ask, knowing what you know now, would you do it again? Absolutely, in a heartbeat. Look at this. Feel like it belongs to me. I felt like my arms did not belong to me. I really, I have had a tummy tuck. I was very overweight when I had my children. Really didn't agree with me. So I have had a tummy tuck. I have had a breast lift. And then I really just had these arms. You can see in the previous videos that flapped in the breeze. And now when I go like this, nothing. It doesn't even wobble. So yes, absolutely. The minor inconvenience, I had 2 nights in hospital, can be done on one night. I just elected to have 2. The minor inconvenience, the little bit of pain, not really pain because the area is numb, it's just that it's a bit stiff. Absolutely. 3 months have been and gone. ISO has been and gone. You don't even know that you've missed anything. So it's really been fantastic. So happy, such a good decision. So lots of people ask, how long did I need to take off work? And I'm lucky that I could work from home. So I had arranged to have 2 weeks off from coming into the office. But if you were able to work from home, I think if you had surgery on Wednesday, let's say, you could certainly have a night or 2 in hospital, Saturday, Sunday at home, and you could be back at a reduced capacity, but certainly working from home if you have an admin role. If you had a more physical role, then I would think that you would probably want that full 2 weeks off, and a really physical job probably 4. But really it's up to you to assess what you need and to know exactly what your job requires. But certainly in this day and age where more people are able to work from home, it absolutely means that less people need to know that you've even had surgery, because you won't be seeing people. With the compression garment, it extends, for me it extended just past the elbow. So I just made sure that I was wearing long sleeves or dresses that had a long sleeve so that no one really could see it. So if you didn't know me, you wouldn't know that I'd had surgery, which I think is ideal for people to be able to get back to work and get back to their normal life. As I said, now I'm at 14 weeks. 14 weeks has gone really quickly. You may not have seen the earlier videos that we made around the first 10 days and how I was feeling. I was a little bit restricted, little bit dinosaur arms, can't really sort of use this. There's stitches, you need to remember, stitches in there, so you don't want to overstretch, and you just want things to unwrap as they go, as you're feeling good. So I'm now back to, full versatility. I'm a busy mum. I can reach the top shelf of the pantry, no trouble, hang out the washing, all of those sorts of things. So I think if you were going to gym, you could certainly be back to gym now. Full, I wouldn't have any restrictions. I did find one thing that I've mentioned to Jenny and Dr. Barnett. I did find, and I've spoken to a few other people, a little bit of nerve twinging when I was reaching out for things, but that has resolved. That did worry me a little bit at about the 8-week mark, and in speaking to a few other people, they said exactly the same thing, but it has completely resolved. So I think that's another thing, to make sure that you're communicating, if you've got any concerns at all with your nurse or your surgeon, to make sure that they're really looking after you in all of those things. One of the best things, I swear by it, was ice. Ice was fantastic. I was back to work at about 3.5 weeks, and I'd come home from work and just feel a bit sore, so I just would use ice packs. Really didn't need Panadol or anything, I didn't need medication, but just the ice was really relieving, so I would really highly recommend that. I've seen a few people that I haven't seen for a while, and they've said, "Oh my God, have you lost weight?" No, I haven't. I'm exactly the same weight. I wish I had lost weight, but no, I have lost, well, maybe, I think they threw 100 grams. 100 grams of lipo and 100 grams of skin. That's what I've lost. But it's just that my arms, as I said, now look like they fit my body. So I went shopping the other day. I bought some lovely shirts that I would never have tried on before, because I would just look at them on the hanger and say, these are not going to fit me. So now I really am actually a 10. Oh my God. It's amazing. Never thought that would happen. Never thought those words would pass my lips. Size 10. One thing I've found more recently is that shopping is much more fun. How is that even possible? I now don't have to allow for my arms, where I would put on a jacket and it would pull here across the top of the arm. Now I don't have to size up for the rest of my body. I can just get what fits me completely. So it's really made that so much easier and much more flattering, I suppose is the word, because it just means it fits me better. And rather than having to buy a 14 for my arms but really only needing a 12 or a 10 for my body, I really don't know exactly what size I am when you go into a shop, because you have to go, okay, does this have skinny arms? Okay, if it has skinny arms, then I need to get a bigger size. And I think that makes shopping online really difficult as well, because you have to guess. So now I found I'm a lot happier, it's a lot easier, it's made shopping experience a whole lot more fun, so that I'm just fitting things better. I feel better. One of the things that I know was weighing on my mind was the scarring. I've had breast and tummy surgery, but those scars are hidden. Nobody sees them unless I want them to. So this is, here on your arm, if you're wearing a singlet, or a sleeveless dress, it is something that will be able to be seen. And even though I have scarred well in the other areas, the arms is an area that can have a less than optimal scar result. So one of the things that really I was really mindful of was that wherever I had my surgery, they did a good scar treatment. They had a great regime for looking after you after surgery, because this area is an area that can scar badly. Décolletage scars badly, arms can scar badly. So I just wanted to make sure that I will be looked after, and bearing in mind that what was there before, I really hated anyway. So, even if I ended up with a scar along here, it's on a smaller area, it's not as obvious. I just think it is something that perhaps puts people off. The scar, but the benefit far outweighs that scar, because I'm just so happy with that. I think it's fantastic. Scarring can take up to 2 years to settle. 2 years is a long time. I'm 14 weeks post-surgery, so if you can see here, this one looks pretty good. It's a little bit thickened here. So I've just had a consult this morning with one of the girls. They're going to let it settle for another couple of weeks and then see maybe some Fraxel, maybe needling, maybe V-laser for the redness. This one here, you can see it's just a little bit, but as it sits in my top, don't really see it. Can't really see it from the front, even if I pull my sleeves up. Can't really see it from the front, can't really see it from the back. So positioning is another thing that is really important, and the surgeons can place the scar in a spot that just sort of just sits right next to your body, so that you can't really see the scar from the front or back unless I run around with my arms in the air, which is possible. So after my surgery, I've now had a consult with our dermal clinicians, and just depending on exactly what needs to be done and what the condition of the scars are, we have a couple of different lasers. You can use different lasers for different things. I'm not exactly sure what exactly they do, but I know the V-laser does with redness, Fraxel can do with texture, and there's needling. There's a whole lot of different modalities that we can use. So I don't mind what they do, as long as they look good. So the girls will tell me exactly what I need to do and what needs to happen, so that we can make sure that the scar will be as good as it can be, knowing that it will take up to 2 years to fully mature. So you just have to be a little bit patient. Often people ask, what did it cost? And I think it's really important that you are aware and talk to a surgeon who is A, fully qualified, B, you have confidence in, has a lot of experience, and that you trust. There are lots of factors that go into cost, and there are lots of factors that go into choosing a surgeon. It is most definitely not something that you should choose on price alone. This is, something that in most days you might see that incision and scars has a lot to do with the skill of the surgeon, your genetic makeup, and those sorts of things, I think, vary a lot. So when you're looking on Instagram or Facebook or YouTube and you see someone who goes, oh, I only paid this much, be wary that you're not them, and that your scar might be different, your incision placement might be different, the length of it might be different. So really make sure that you're comfortable and confident in the skill of the surgeon that you've chosen. Of course, no one has bottomless pockets, but you need to make sure that you are really researching who you're choosing to do this, not just someone who says, oh, I can give that a go. So just make sure that you really have researched and that you're very confident, and know that the price is going to vary from state to state, from country to country, and from surgeon to surgeon. One of the things that I think is really important is for you to actually book a consult with a surgeon and go and see them and have a discussion. Often we have a figure in mind that might be wildly different from actually what the real figure is going to be. You might find that, you thought it was going to be much higher than it actually is, or you thought it was going to be much lower because you didn't realize everything that's involved and how long the procedure is going to take. So having a consult doesn't lock you into having a procedure. It just means that you're coming to see the surgeon, to meet the team, to see where they practice, where all your post-operative appointments will be, what garments are included, all of that sort of stuff that should be included in your surgery. You will get to sort of get a feel for that. So make sure that you do that. We often recommend that people have at least 1 or 2 consultations, just so that they're comfortable and they fully understand exactly what's going to happen and how you're going to proceed. So one of the things that is really important when you are looking at costings, surgeons, clinics, is to make sure that you're comparing apples with apples. Often you'll get a quote for X amount, and that is only the surgeon fee. It doesn't include the hospital, it doesn't include an overnight stay, it's done as a day procedure, and it makes it difficult for you to know exactly what you're getting. So you can always ask for what's called a fully informed financial consent. That should list everything that you are obliged to pay for. The surgeon, the anaesthetist, whether your surgeon uses an assistant. It's better if they use an assistant because it means you have less general anaesthetic, you're less time in theatre, so those costs should be less and they won't be increased by the amount of the assistant. Does it include garments? It's really important to wear a compression garment after you've had brachioplasty. Does it include scar treatments? Are they going to look after you when you get to that 12-month mark and there's a little bit that needs a revision? Is that something that's going to be included, or is that something that's going to be an additional cost to you? So really make sure that when you're looking, you're finding out everything that's involved. Don't just jump on a little number and say, oh yes, that sounds good, because it's not just like you're buying a block of chocolate that's 100 grams everywhere. Wherever you go, what you're getting is different, and it is different in different practices. So just look at that and make sure that you're happy with your decision. So in wrapping up, I really would like to say, if this is something that you're interested in, I would highly recommend it. I would highly recommend that you have a consult. Just start. If you've not seen a surgeon or you've not done any research, just get the ball rolling. Find out what's possible for you, what the possible costs might be. Find a practice that you like, where the people are friendly, where you feel comfortable, and have a consultation. Now, people say, oh, it's $300 to see each surgeon, that's $1,000. You really need to think of it as an investment in making sure that you're going with the correct person for you. This is going to be here forever now, and I need to know that the practice will look after me, the surgeon will look after me, that I feel happy and confident in what they've done. So just start, get the ball rolling, see what you can do, see what's affordable, see what's possible, see how you think, and then you'll know whether it's something that you really do want to commit to. For me, I'm thrilled. It's one of the best things I've ever done. So I would wish that for you as well, to feel the same way.